Are you worried that you, your child, or someone you know may have diabetes? Having some diabetes symptoms doesn't mean you definitely have the condition, but you should always contact your GP, just to make sure. Diabetes is a condition that causes a person's blood sugar level to become too high. There are two main types of diabetes. 1. Type 1 diabetes. A lifelong condition where the body's immune system attacks and destroys the cells that produce insulin. 2. Type 2 diabetes, where the body does not produce enough insulin, or the body's cells do not react to insulin properly. Type 2 diabetes is far more common than type 1. Over 90% of all adults with diabetes have type 2. Pre-diabetes. Many people have blood sugar levels above the normal range, but not high enough to be diagnosed as having diabetes. This is known as non-diabetic hyperglycemia, or pre-diabetes. People with pre-diabetes are at greater risk of developing type 2 diabetes, but the risk can be reduced through lifestyle changes. People with pre-diabetes are also recommended to have a blood test every year to monitor their blood sugar levels. It's very important for diabetes to be diagnosed as early as possible because it's likely to get worse if left untreated and can cause long-term health problems. What are the most common symptoms? No individual is the same. The symptoms you experience won't exactly match those of another person. However, the most common diabetes symptoms experienced by many people with diabetes are increased thirst, increased urination, feeling tired, and losing weight. When to see a GP? Visit your GP as soon as possible if you experience the main symptoms of diabetes, which include 1. Feeling very thirsty. 2. Peeing more frequently than usual, particularly at night. 3. Feeling very tired. 4. Weight loss and loss of muscle bulk. 5. Itching around the penis or vagina, or frequent episodes of thrush. 6. Blurred vision. Type 1 diabetes can develop quickly over weeks or even days. Weight loss is common in people with type 1 diabetes when it first develops and before it's treated, but it's less common in people with type 2 diabetes. Many people have type 2 diabetes for years without realizing because the early symptoms tend to be general, or there are no symptoms at all. Causes of diabetes. The amount of sugar in the blood is controlled by a hormone called insulin, which is produced by the pancreas, a gland behind the stomach. When food is digested and enters your bloodstream, insulin moves glucose out of the blood and into cells, where it's broken down to produce energy. However, if you have diabetes, your body is unable to break down glucose into energy. This is because there's either not enough insulin to move the glucose, or the insulin produced does not work properly. There are no lifestyle changes you can make to lower your risk of type 1 diabetes. You can reduce the risk of type 2 diabetes through healthy eating, regular exercise, and achieving a healthy body weight. You may be more at risk of type 2 diabetes if you 1. Are living with overweight or obesity. 2. Do not have a healthy diet. 3. Have a family history of type 2 diabetes. 4. Are of Asian, Black African, or African Caribbean origin. 5. Take certain medicines such as steroids for a long time. 6. Have high blood pressure. 7. Have had gestational diabetes during pregnancy. Living with diabetes. If you're diagnosed with diabetes, you'll need to eat healthily, take regular exercise, and have regular checks including blood tests. You can use the BMI Healthy Weight Calculator to check whether you're a healthy weight. Try to quit smoking if you smoke, and cut down on alcohol. People diagnosed with type 1 diabetes also require regular insulin injections for the rest of their life. Type 2 diabetes can get worse over time, and people living with type 2 diabetes often need medicine, usually in the form of tablets or injections. However, some people can put their type 2 diabetes into remission by losing weight, where their blood sugar is reduced below the diabetes range. Some people are able to do this through a low-calorie diet, but this is not suitable for everyone, so it's important to get medical advice first. Diagnosis and treatment. Early diagnosis can be accomplished through relatively inexpensive testing of blood glucose. People with type 1 diabetes need insulin injections for survival. One of the most important ways to treat diabetes is to keep a healthy lifestyle. Some people with type 2 diabetes will need to take medicines to help manage their blood sugar levels. These can include insulin injections or other medicines. Some examples include metformin, sulfonylureas, sodium glucose cotransporters type 2, SGLT2, inhibitors. Along with medicines to lower blood sugar, some people with diabetes need medications to lower their blood pressure and statins to reduce the risk of complications. In the end, remember to check with your doctor regularly and to talk with him about your concerns. Thanks for watching. Don't forget to like and subscribe.